We'd like to introduce Kevin. He's one of our patients. He's just completed our program, and we have a couple questions to ask you, Kevin, about your experience here. How did you hear about our program?
Through the ER doctor.
And how did that go? You just went into the emergency room?
Went into the, saw that my arm was not doing too well, went into the ER, he looked at it, got on the phone right away, and next thing I know, I was sitting in this office.
So, how did you get an IV access? Did you go to the hospital, or?
Yeah, I was in the emergency room. They recommended that I come here, got a PICC line done, which was in the hospital right next door to here, so I walked right across the hall, came back, and basically that was it.
And how was that process? Was it hard, or?
15 minutes.
15 minutes, and then you were back up here. And so afterwards, what kind of experience were you in the office? Can you describe your first day here?
Quick, easy, instructional. I mean, everything I needed to have done was all explained to me, just like that.
Okay.
Got everything I needed and was on my way.
And so your experience, you would say, was good for education, teaching?
Excellent.
Did you have any questions when you left?
No, I was able to do it on my own from the time that I left right to the time I got home.
Okay. And how about the nurses? Did you find they had experience, or were they, knowledgeable?
Everybody was knowledgeable here.
Okay. And resources, did they send you home with any handouts or any information?
Gave me everything that you could possibly need. I mean, a bunch of paperwork, easy to read, easy to understand. 1, 2, 3, and I was done.
So describe your experience at home infusing yourself with the antibiotics. How did that go for you?
It was good. Didn't have to wait on anybody to come and help me with it. I mean, literally, I was able to do my own time, take my own time whenever I needed to do it, whenever I wanted to do it. I mean, as long as I did it that day, there was nobody standing over me, waiting on me. I was able to do it by myself. So.
Okay. How about maintaining the PICC line? How was that experience for you?
Simple, easy. I was able to shower every day. I was able to wrap it. Wasn't any discomfort. I was able to sleep at night.
Okay.
I mean.
And how about, did you have anybody assist you with this process at home? Or?
You know what, maybe the first day I just had somebody just double check me, but then after that I was actually, midway through it, I was doing it myself.
Okay, and follow-up appointments, coming back to the clinic, how often did you have to follow up with the clinic and with the
I think in the entire time that I did it, maybe twice, and actually on my second time I think was the time that I had my PICC line removed.
Okay, and so kind of describe your office visit the second time you were here. Did you have to wait a long time? What happened? Describe that experience.
Came right in, test looked good. 5 minutes later, took off the dressing, pulled the PICC line, and I got this nice little certificate.
Okay, and you have any recommendations for somebody who's looking at doing this?
I would recommend it to anybody. If you can skip going to the hospital, this is the way to go, definitely.
Okay, well thank you, Kevin, and congratulations.
Thanks.